Hello. Now Deb Gardner is going to talk to you about medications and the proper ways to take them. Deb is a registered pulmonary function technologist and has many years as a respiratory therapist. You may think that the medicine is expensive, but here's something to think about. Taking your medicine is far less expensive than even one hospital visit. So with that, here's Deb.
My name's Deb Gardner, and I'm here to show you how to get the most out of your medications. We'll be showing you a list of drugs, both the generic and the brand name, and what they do. You might want to pause this video when we show you the list, and then write them down. Let's first talk about rescue medications. Rescue medications are short-acting bronchodilators, and they work for about 4 to 6 hours. Now, a bronchodilator is a medication that causes the smooth muscle tissue around your airways to relax, causing dilation of those airways. Now let's talk about controller medications, which are long-acting bronchodilators, and they give about 12 hours of relief. They also take a little longer to start working than the rescue medications. We'll be talking about inhaled corticosteroids. Corticosteroids are an anti-inflammatory drug. They reduce the inflammation in the airway, again causing dilation of those airways. Depending on the stage of your COPD, you may be on a corticosteroid as a maintenance drug or for a short period of time to get over the flare-ups. If you're taking them for short term, the dose needs to be tapered off. Don't just stop taking them. If you're on a maintenance drug, it needs to be taken every single day, rain or shine. I want to talk about 2 maintenance drugs in particular. They are Advair and Symbicort. These are the brand names of 2 maintenance drugs that combine a corticosteroid and a long-acting bronchodilator. Advair is given a little differently because it comes in the form of a discus. You've probably seen ads on TV for this. You can't use a spacer with a discus and should never put it in water. This is how you use your discus. The first thing you do when you take it out of the pouch is date it 1 month from the day you open it. About a week before that date, you get the prescription refilled. Now that you've done that, look at the number counter on the right side of the discus. As each dose is used, the counter will go down. Remember to keep the discus level from when you are priming it until you have taken the medication. To prime the discus, hold it in one hand while you put one of your thumbs in the indentation next to the counter. While exhaling slowly and completely, move your thumb to the other side. Notice that Louise is using the pursed lip method. It will snap in place and you'll see the mouthpiece. Every time you move the lever, a dose of medicine is used, so don't be moving it back and forth. Put your mouth on the mouthpiece, but never blow or exhale into the discus. This one you will want to take in fast. It's a dry powder, and you need to take it in fast to get all of the medication. Don't forget to rinse when you're done. Some people use it before they brush their teeth, but if you just swish and spit, that's okay too. To clean the discus, wipe it with a dry cloth. Symbicort resembles the traditional MDI, except you put this one in your mouth and close your lips around it. Inhale slowly, just as you would with other MDIs. Clean it once a week with a clean, dry cloth, but don't put this one in water either. Cough medicines now, they curb your cough. Well, they're not recommended. Coughing is getting the secretions out of your lungs. And speaking of coughing, if your sputum changes color, or you have a temperature, or are getting more short of breath, or your oximeter reading is dropping, call your doctor. You may need an antibiotic. Also, if you've developed COPD before the age of 45 or have a family history of COPD, get tested for alpha-1 antitrypsin deficiency. Alpha-1 is a gene deficiency that runs in families. Now we're going to show you the proper way to use your MDI and SVN. Studies have shown that there's no difference in effectiveness when comparing the SVN and MDI. But some people may have trouble using the inhaler because they can't activate it, either because of arthritis, tremors, or they just prefer one over the other. Whatever works for you. Whether you use an inhaler or small volume nebulizer, I'm going to show you the proper way to use them to get the best use of your medicine. Let's start with your inhaler. Some inhalers, such as Max Air or Autohaler, automatically release the medication when you take a breath. Most of the others don't, though. It is recommended to use a spacer with your inhaler because you'll be getting the most of the medication that way. If you don't already have a spacer, you can get one online. When you use a spacer, your lungs will get more of the medication in them. Here's how to do it the right way. The first time you use an inhaler, it needs to be primed. Shake the inhaler for 5 seconds. Now, there's a drug called Atrovent, otherwise known as ipratropium, that needs to be shaken for a full 15 seconds. Point it away from your face and press down 3 times. You don't have to do this again unless it's been a couple of weeks since you used it. Now you're ready to take your medication. This may sound silly, but don't forget to take the cap off. Exhale completely. Put the spacer in your mouth and take a slow, deep breath. If you hear a whistle, you're doing it too fast. Slow down until you don't hear the whistle. Hold your breath for a count of 10 and exhale slowly. Wait at least 1 minute before taking another puff. The holes in the inhaler mouthpiece can get clogged, so about once a week, or if you notice that the medication isn't spraying right, take the inhaler canister out and rinse the inhaler mouthpiece in running water, and then let it dry overnight. Is the spacer too big to carry in your purse or pocket? You can use a 6-inch piece of corrugated tubing instead. It doesn't have all the bells and whistles that a spacer has, but it can be just as effective. I know what you're thinking. Where in the world do I get corrugated tubing? Try the respiratory therapy department at your local hospital. They'll usually give you some. It attaches to the MDI like this. If you can't get your hands on the spacer or corrugated tubing, here's a non-spacer method. It's done exactly the same way as with a spacer, but the inhaler does not go in your mouth. It should be held 2 fat fingers or 3 skinny fingers from your mouth. Most of the inhalers today have counters on them, but if yours doesn't, the medication insert tells how many puffs are in the canister. If you use your inhaler regularly, you can divide the number of puffs you use each day, and that will tell you how many days your inhaler will last. Let's say your inhaler holds 200 puffs, and you use 2 puffs 4 times a day. That's 8 puffs a day. 200 divided by 8 equals 25. Your inhaler will last 25 days. Write the date 25 days from when you start using the inhaler. Remember, just because your inhaler sprays doesn't mean there's medication in it. It could be spraying propellant. Now for the small volume nebulizer. Inhale larger than a normal breath. Hold it in your lungs for a few seconds, then exhale. By breathing this way, you let more of the medication stay in your lungs instead of just blowing it right back out. Be careful. If you feel dizzy or lightheaded, slow down or don't take as big a breath. You're thinking about breathing and may tend to hyperventilate. Even though you can't put the discus in water or disinfectant, you should clean your spacer and inhaler mouthpiece about once a week. Sooner if it starts to look dirty. Also, depending on your insurance, you may or may not have plenty of nebulizers for your SVN. If you have trouble getting enough SVNs, to disinfect them too. Let it air dry overnight. You can wash your equipment in dish soap, rinse with tap water, and let that dry overnight. Don't put it in the dishwasher unless your particular equipment says that that's okay. If you think it needs a little more cleaning, you can make a disinfectant from items you can get at your local supermarket. Here's how to make the disinfectant. Add 1 ounce of household bleach to 1 gallon of tap water, and then add 1 ounce of 5% distilled vinegar. After all of this, I hope you understand your medications a little better. If you have any questions, you can ask your doctor, your pharmacist, or your respiratory therapist.